Hello and assalamu alaikum, ladies and gentlemen. Welcome back to another exciting episode of the Swanky Doctors podcast. This is your host Ali Haider, and today we have a very special guest with us, Dr. Afreen Mubin, who is a general physician working in UAE, and today he will be guiding us about the entire UAE route for doctors. So, Dr. Afreen, welcome to the show, and thank you so much for joining us today.
Thank you, Dr. Haider. It's my pleasure. Yeah.
Okay, so Dr. Afreen, we will start with a couple of basic questions like where were you born and how was your early life like, and where did you get your early education from?
Yeah, so I'm basically from India, the southern part of India, which is called Karnataka. So I did my schooling and med schooling, everything from there. So I pretty much I spend all of my life in India, that particular part of India, all of my life until I moved to UAE. Yeah. So all of my life, pretty much my education, med schooling, my internship, my work, and everything was in India.
So I would like to know, okay, how was the life like in med school back in India?
India, I would say med school years, the 5.5 years in the med school will always be the best years of your life. You will realize it when you finish. But if you ask me honestly, I think the first year and the internship will be my best years. First year,
Okay.
because that is the phase when you're just bursting with excitement, and you're trying to make friends, interacting with people. You've just gotten into med school and you have that feeling of going to become a doctor. So
Yeah.
that is the best phase. And then internship, I would say, because you have already won half the battle. That is, you have passed your final year and you're just one step closer to being
Yeah.
graduated. So there's nothing, bigger or surreal feeling than getting graduated. And the graduation day will be the most memorable day. So I think, yeah, pretty much first year and final year, the internship year will be my best time of med school.
Okay, so Dr. Afreen, I am very much interested in knowing okay, how does the entire healthcare system or the medical education in India works. Like you guys have all-time famous IITs for engineering students. So how I would like to know okay, how has India improved in terms of medical education and how have they modernized their curriculum?
India is known to have a great medical, teaching training programs in India because of AIMS. And you said you talked about AIMS, right? Yeah. So
I talked
AIMS,
about IITs for engineering students. Like it is
engineer.
all-time
Okay,
famous.
yeah. IIT also, and India is a medical as well as IT hub, if you
Hmm.
know.
Hmm.
So it's diverse even in culture and even in education programs. So a lot of students, even from outside, we have a lot of foreign graduates coming and learning things from Indian
Hmm.
IIT, and even in the medical. In my college, my hometown, in my college as well, there were many foreign students also
Yeah.
who wanted to come in because it was one of the best colleges in my hometown and the entire state, I would say. So
Okay.
yeah, India is. uh, I don't know much about your country, but India, yes, it's a hub for IT as well as medicine.
Okay,
Yeah.
that's impressive. And so, coming towards the personal life, like
Yeah.
what kind of extracurricular activities were you involved in during your undergrad days?
Extracurricular activities. See, I was not much of a nerd, but Alhamdulillah, I was able to manage, completing my entire undergraduation in one go without having any backlogs or anything. So yeah, थोड़ी बहुत nerd नहीं बोलूंगी, but
ऑब्वियसली वो तो
extracurricular में
सारे मेडिकल स्टूडेंट्स का ही होता है,
ज्यादा
बट आई वुड लाइक टू नो कि आपकी पर्सनालिटी का मुझे थोड़ा सा बैकग्राउंड चाहिए सो दैट मैं उसको प्रोजेक्ट कर सकूं कि आगे आपकी जो आपके एंटरप्रेन्योरियल आपके पास जर्नी थी वो भी उसकी बैकिंग ऑब्वियसली जो इंसान सीखता है सारा कुछ इन द अर्ली लाइफ वो ही आगे जाके प्रोजेक्ट कर रहा होता है इन द कह लें कि प्रोफेशनल लाइफ। सो मैं इस पर थोड़ा सा चाह रहा
yeah,
हूँ कि व्हाट काइंड ऑफ
yeah.
एक्टिविटीज यू आर इन्वॉल्व इन।
Activities, see, I was a day scholar. So what happens in my college, day scholar students को ज्यादा अपना creativity दिखाने का मौका नहीं मिलता है, because we
या
just go to
एग्जैक्टली।
college, come back home, and whereas the hostelites,
हम्म।
they had the most fun, and we kind of, we scholars were kind of envying them also because we didn't get that opportunity and we didn't have that much time. We didn't have that much of time with the friends, to spend and
या
show our creativity level and all of that. But yeah, I was Um,
Okay,
uh,
now let's move forward.
they're not very much into sports or anything, but maybe the creativity part, yes. Yeah,
Okay,
I was more of creative. I was into creativity aspect, you could say, but not sports. I was not much of a sports person. Yeah. So yeah, it was pretty boring, you could say. I have nothing much to say about my undergrad other than just, passing in one go and just finishing, scooting off and enjoying my internship. That's it. Other than that, nothing great.
okay, that's an achievement at its own. So I would consider it a big thing. So, Dr.
Yeah.
Afreen, I would like to know what inspired you to pursue a career in medicine? Like, is there a particular story behind it that you would like to share?
I would say my parents actually, because बचपन से ही my parents used to, feed me कि तुझे डॉक्टर बनना है, because my
Yeah.
brother they had the thing, मेरे बड़े भाई को बनाना था, but वो तो हुए नहीं, तो अभी तो तू बची है, तो you have to be. So I was kind of programmed,
Okay.
programmed बचपन से, you had to become a doctor, you have to become a doctor. So that's why I took science and I joined med school. So that's it. I owe it all to my parents, and I think that's the best decision ever.
Okay.
Alhamdulillah.
Okay,
Yeah.
Alhamdulillah. So now coming towards the other part, can you please share a particularly rewarding experience that you had during a medical training till now?
Rewarding. See, it's no secret that medical school is hard. It's very tough compared to other counterparts.
Yeah.
It is undoubtedly hard, but the rewards that you get, the opportunities that you will get in your med school as well as after you finish is satisfying, and it's all worth it. And especially if you ask me one or two, I would say, see, especially after you become a doctor, that is after your graduation, you will come across so many patients. So that smile that you see on their face once you have cured them of the disease, that is just out of the world. You
Yeah.
will have the most peaceful sleep that night, knowing that you have cured a patient's illness. That there's
Hmm.
nothing more rewarding than that. And see, God has given you the ability to bring a change or a difference to somebody's life, touch somebody's life. So
Yeah.
what more rewarding than that, right?
Yeah. You're absolutely right. So, like now, I would like to know, how did you start your professional career? Like, did you practice in India initially, या फिर start से आपका plan था कि you would move to Dubai after graduation?
No, actually, मैंने बहुत सालों पहले I finished my graduation, and उसके बाद I worked in the emergency medicine. Actually, I was the major chunk of my medical career was in emergency medicine. So soon as I finished my graduation, I think after 2 months itself, I joined a private hospital in my hometown, and I joined as a duty medical officer, a junior doctor in the emergency department. And I got to learn so much. I was there for like 3 to 4 years, and I learned so much from my seniors and doctors, and a lot about emergency, a lot about emergency and ICU. So whatever I could polish my basics from my seniors. And then after that, I moved to another multi specialty hospital that is really well known in India. So that was in another city. I will not name it, but that was another place where I joined as a emergency registrar. And I had the honor to work, or to work under the guidance of the one of the pioneers of emergency medicine. She's well renowned in the world, Dr.
Okay.
Mabel.
Okay.
So I really have had the opportunity to work with her, and she was the one who pushed me to take up MRCEM. So I had even joined MRCEM course for some time, and then I was preparing for part one, almost going to give part two, but Destiny had some other plans, and we had to move to Dubai. So that's the reason I couldn't continue my career in emergency, and then I had to make a big switch to OBG. So not many of you know this. Even just a very few people know about it, because I still haven't finished. I'm pursuing my professional diploma in OBG from the Royal College of Physicians of Ireland. So I'm doing that at the moment. I'll be finishing in a couple of months. So until then, I didn't want to reveal it. Now because
Okay.
you're asking me, I'm saying it. So yeah,
Coming towards
that's
that
about.
point, when and why did you decide to move to Dubai? Like, it was a big career switch.
Yeah, it was not for my career switch. Okay, it was. I'll tell you. See, Dubai happened by choice. It was not,
Okay.
it was very much pre-planned. It was because of my husband. My husband is also a doctor. He's a pediatric intensivist. He
Okay.
got a job in Dubai. So I just tagged along. It was
Okay.
sort of a free pass for me to go with him. So, and then, yeah, it was pre-planned. And then I think that was the best thing that happened to us because we landed in UAE just 1 week before the pandemic hit. So I think that is
Okay.
the best thing that happened to us. Otherwise, we wouldn't have probably made it here.
Okay.
So
That's great.
yeah, and the career switch, I would say, see, for the longest time, I did not work in UA because of the pandemic. For nearly 2.5 years, I was just doing nothing, and then I decided I'll do something where I can give time to family, and clearly emergency was not the choice.
Yeah.
With emergency and plus my husband being in the ICU, it was really tough for us to look after the kids and all of that. So that's why I thought, okay, let's switch and continue in OBG. That
Okay.
that is the reason for the switch.
Sahi. And Dr. Afreen, can you please shed a light on the this part? Ke, how is the life like for a doctor in UAE and particularly and the work-life balance wala part? Because being a doctor couple, I can understand ke how difficult it would be for you guys to manage the thing. So please shed a light on that part.
Yeah, see, UAE is definitely one of the finest places or finest countries in the Middle East region to work because it is the most developed country in the region. But see, there is no but. Before I come to the but, I'll tell you the pros.
Okay.
In terms of, it is one of the best and the finest in terms of security, tax-free salary, and family. You get a lot of time with your family for the entertainment part and many things. On the other hand, there's a small setback or a drawback, I would say, and that is when you're working in a hospital as a doctor,
Mm-hmm.
you do not have free hand. You have to abide by a lot of rules and regulations of the hospital, and you have to stick to the protocols and the government laws and insurance, a lot of things, which we don't normally see in our home countries. So that
Yeah.
is one small thing that you will have to abide by. It's everything's rules here. So you have to stick to a lot of rules. You do not have free hand. You cannot do things freely here. So that's the only thing. Otherwise, it's the best place to work in terms of quality of life mainly.
Okay, that's cool.
Yeah.
So now I would like to come to the other part of your life. Like recently, you have started mentoring or guiding other young doctors, like how can they move to UAE or other Gulf countries. So I would like to know, okay, how did that start and what's the aim behind it?
Yeah, so this is a long story. This was actually not planned. This mentoring thing just happened by chance, and the reason is, I'll tell you why. See, I told you a few years back when I came here. Initially, I did nothing. I was just sitting at home and doing nothing. I was clueless, how to join work because in our countries it's easy. You just go find a job and just start working. Whereas here in UAE, it's completely different. You have a long procedure to go through before you actually join work. So when I started out, I found the process to be so confusing, and I had no clue. Basically, I was clueless
Yeah,
because you had long admin work. Following that, you have to sit and study for your exam, like 19-20 subjects for a GP. That's like too much, because you have studied all these subjects many years ago.
yeah,
So at one point, though, I thought, मैंने सोचा कि I'll just go back to India and just continue working there because no point.
yeah.
What is the point of wasting? I've already wasted time. But then my husband, alhamdulillah, he helped me with the admin part. Abhi raha kya exam. Admin part hone ke baad you have to study for the exam. And for that, again, I was back to square one. I didn't know what to read. I was clueless. Then I
Yeah.
joined, then I came across many Telegram groups and there were many online subscriptions. Many people are offering subscriptions. So, but I was not really satisfied, or I felt a sense of incompletion. कि यार मैंने complete नहीं किया. This is not sufficient for me to pass. And then just 3 weeks, I remember 3 weeks before my exam, I came across a training academy, medical MCQ for all by Dr. Munjal Pandey.
Yeah.
So I contacted him, and then the rest is history. I contacted
Uh,
him, and then he really guided me, and I gave my exam, and then the rest is history. And then the reason for being a mentor was to guide foreign medical graduates like me who are clueless and, to give them a direction, at least make a simple pathway for them. And because I have gone through all the exercise, I have done all the exercise, trust me. So
Yeah.
it's just give them a easy pathway, simplified channel to tell them what to do, what not to do, so that it's easy, it saves their time and, energy and all of that. So,
Okay.
and from the time I have started mentoring, I think I've been getting a lot of DMs from doctors. This is one thing I've seen, that they have no clue basically, which they have no clue how to go about.
Yeah.
So I think it's very rewarding that way also, so that at least I'm of some help to the foreign medical graduates.
That's
So
impressive.
that is what
So, Dr. Afreen, for our audience, can you please briefly explain like the entire pathway of how to enter the Dubai's healthcare system?
see, pathway is if you are a foreign medical graduate wanting to come to Dubai, you will have to abide by certain regulations, formed by the government. DHA. DHA is Health Authority of Dubai. So that is only for Dubai, not for other Emirates like Abu Dhabi and Sharjah. It doesn't belong to that.
Okay.
So if you want to come to Dubai, you will have to do the admin part that I just spoke about few some time back. The admin part is the DHA registration. You will have to register yourself with the DHA, and then you will have there is something called as initial assessment. So this is done by uploading all of your documents as well as your experience letters on the DHA official website to see if you are eligible or not
Okay.
to work your way. So that is the second part. And third is, once you are given the eligibility, you will have to submit all of your documents to something called as primary source verification, PSV,
Okay.
which is done by a company called Dataflow. Okay, so this is a lengthy process, but it usually takes about 3 weeks to 2 months time. So uske baad, what happens is you have to give your exam. Once all of this is clear, your data flow is positive, you are eligible to give your exam. But
Okay.
one thing to note is you can even give your exam even before these, admin, this all of these things. You can give your exam, but what happens is, suppose your data flow comes negative, your examination report, the result, even if you pass, it's of no use. So that's
Okay.
why it's always best to complete all of these things, the registration, primary assessment, as well as data flow. Complete it and give your exam. It's always better.
And can you please briefly explain what's the entire syllabus for this exam and what are some of the recommended study resources for this exam?
See, the syllabus varies for different categories. Okay, so the different categories are, if you are just an MBBS with some diploma or fellowship that's not recognized by the Dubai government, you fall in the category of GP, general practitioners. Okay, and specialist. There is the other category called specialist. Specialist is if you are if you hold a post graduation degree like MD with 3 years experience. GP again, you need to have 2 years experience post internship. For specialist, you need to have 3 years experience post internship. So the syllabus varies for different categories. For the syllabus for GPs is all, it's all given on the official website, DHA website. There are a lot of things, if you go through it, you will know. Everything is clearly mentioned on the DHA official website, even for the specialist. Specialist as in for surgery, for OBG, for ENT, and, different specialties, you have different syllabus.
Mm-hmm.
Yeah.
Fine. Okay. So can you please shed a light on the cost associated with this pathway? Like most of the young doctors will be mostly concerned with the cost because the other pathways like USMLE or PLAB, they are quite expensive. So I would like to know, okay, what's the cost associated with this DHA wala pathway?
Yeah, the cost is, see, again, cost depends on your category. For GP category as well as your documents, the number of documents you're sharing. Documents as in your degree certificates and your experience letters. If you have more number of experience, more years of experience, again, the experience letter will be more. So the count will be slightly more for them. And for specialist, it's slightly more than the GPs. So I think roughly I would say for a GP would be 5,000 AD, 5,000
Okay.
dirhams.
Mm-hmm.
So
Fine.
you can convert it in your currency, local currency. And I think you asked me about the study materials, right? So the study materials, I would say, as a mentor myself, I would suggest do not just loosely, this is one common practice, wrong practice, what I see everybody doing, most of them
Mm-hmm.
doing at least. They just loosely pick up random PDFs or, files and just start reading without having any knowledge about the concept. So the most important thing is you need to have concept-based learning. Study material is, see, the exam pattern that we have is prometric MCQs. It is in multiple choice question pattern. And what they ask is mainly clinical. They mainly test our clinical knowledge, nothing else. They want to see how good you are with clinics, how good your clinical knowledge is, because you are eventually seeing patients, right? You will get all sorts of patients. So they want to see if you're able to manage that patient or not. And it's highly, highly, highly inspired by Step 2 CK. I mean,
Okay.
USMLE pattern. So
Okay.
I would suggest make Step 2 CK and MTP3 your best friend. That is what I tell everyone. So this is the standard book that you can read for DHA exam. DHA, whether it is DHA or HAD or MOH or any prometric exam, Step 2 CK is your book.
Mm-hmm.
Yeah.
Okay. And Dr. Afreen, like, is it compulsory to write this exam, particularly when one is in Dubai, या फिर किसी भी prometric center worldwide आप किसी भी कह लें कि prometric center में चले जाएं, you can attempt the exam over there?
Yeah, you can.
Okay.
You can. Has to be, I think, Gulf prometric exam only. I think in your country also there is, because a lot of doctors are giving prometric. It has to be Gulf Prometric Exam Center. Yeah.
Okay.
Anywhere, any country, even from my country, you can just sit and just schedule your date when you want to book the exam and just go and give. Not an issue. You don't necessarily have to come to Dubai and give. No, you can give it from your country.
Okay, fine. And what are some of the common mistakes that doctors generally do when they are appearing in this exam?
Common mistakes. See, the first and foremost thing is they don't know the syllabus. They
Okay.
just randomly go on reading. Because for GP is one of the most toughest I would say, because you have multiple subjects to read. You're not sticking to one subject like a specialist. If you are a surgeon, you would only require to be, you would be reading only surgery, right? General surgery. But for a GP, you need to read surgery, gynecology, medicine, endocrinology, hematology, oncology, everything. You are supposed to know everything. So the most important thing is you need to know your syllabus, which is there on the official website. And the second mistake, what I see is not learning the concept, not having this concept based learning. What I would recommend, see, it's very simple. If you know the concept or a basic fundamental, if you have an idea about that particular subject or a topic, you can answer anything, any question asked on that particular thing. Like, for example, I'll just give you a small example. ADH, anti-diuretic hormone. If you know what it does to our body, what it does inside our body, you will be able to answer what is SIADH. You will be able to answer what is DI, diabetic insipidus, right?
Yeah. Mhm.
You just need to know the fundamentals, the principles, just the basic concept of what ADH is.
Got it.
If you have these concepts clear, you can answer what is not normal. You will be able to answer any questions asked on that particular topic. So yeah, that is the second. And lastly, I would say just loosely picking up any random files or PDFs and just going on cramming. You should never. You need to understand the concept. You need to look at every question, every word in the question, and then attempt the question. Yeah.
Got it. So, Dr. Afreen, once one is done with the exams, how can one find the right job in the Dubai healthcare system? Like, do they have a very comprehensive residency program like the one in US, या फिर हर एक को privately खुद ही job find करनी होती?
See, residency is completely different. This DHX is not for residency. It is to work. It is to be eligible to work here. A residency is entirely a different entity altogether.
Okay.
I'll come to the residency part later.
Mm-hmm.
For the work, I said, see, if you have your positive data flow report, and if you have passed your DHA, they will give you an eligibility letter, something called as an eligibility letter. With this eligibility letter, you can go and find if there is any vacancy. You can go and approach the hospital and tell them, see, I have an eligibility letter, I can work in Dubai. And if they have a vacancy, they will give you a job. When they
Okay.
give you a job, they will issue a license as well. They are the one, the company or the hospital is the one that issues license for you.
Okay. Got it.
So with this license, you're eligible to work in that particular hospital that is issued license, not anywhere else.
Oh.
So that's another important
And
point.
what about the residency wala part?
Residency, for the residency, see, it's a very, very, very difficult pathway to take in UAE because residency is not easy here for an outsider. Firstly, the priority is given to the UAE nationals, the locals here. The first priority is for them. And secondly, if you really, really want to get into residency program here, you will have to be a medical graduate from a institution recognized by WHO.
Oh.
That's one thing. Secondly, you will have to complete your internship program of 1 year without a break. Okay, after your exam, after your completion of graduation, you will have to complete your internship of 1 year. You will have to have English language proficiency. That's needed, IELTS. So that is needed. And apart from that, what is it? You will have to give EMRI. There is something called as EMRI exam. Okay, Emirates Medical Residency Entrance Exam. That is for the medical MBBS students, and for dental, it is EDRI, Emirates Dental, Emirates Dental Medical Entrance
Residency.
Examination.
Okay.
Yes. And apart from this, you will have multiple mini interviews, which only passing is not sufficient. You will have to ace the exam. You will have to really have a high score. So these are the steps for just obtaining an residency program here, which is really, really tough. And lastly, I would say, I think in our countries, I don't know how it is in your country, it is just 3 years residency, post-graduation. But here in UAE, it is very long, lengthy, 4 to 6 years. It's a 4 to 6 years program. So these are things, and it's very difficult for expats to get in.
Okay, so Dr. Afreen, can you please shed a light on the salary structure of junior doctors working in Dubai healthcare system?
Junior doctors, as in GPs, you mean? General practitioners?
Yeah.
General practitioners, see, it depends on your portfolio. It depends on your CV and what. See, GPs does not mean only MBBS. GPs can be diploma degrees who are really, practicing doctors in their own countries, like dermatologists, gynecologists. But that is not recognized here. Diplomas are not considered, it's not an MD degree here, right? So it's not really recognized, and they will not give you a specialist post. And you only have to work as a GP. Even though you are a surgeon or an orthopedician or a gynecologist in your country, because you don't have an MD degree, basic MD or MRCP degree, you will have to work here as a GP. So the salary again depends on your degree. If you are just an MBBS with just 2 years of experience, your salary will not be as much as the doctors who have, higher number of experience, more number of years of experience with some diploma degree or some, outside fellowship. So it all depends on all of these criteria.
Still, can you please give us a range, from where it starts and?
You can very, the beginners can earn from 10 to 20,000, I would say, between 8 to 20,000 in the range of that. Dirhams.
Okay, fine. Got it. So now coming towards the other part of your life, Dr. Afreen, I would like to know, okay, what inspired you to start a blog on Instagram? Like, I have been following you for a while now, and you're doing an amazing job over there. So what's the story behind it?
Thank you. The story actually dates back to, 3 years when I just got to UAE, and I had nothing to do in this foreign country. I was just, sitting at home because of the pandemic, and I had a baby to look after. So there was nothing. I was just looking. I was trying to make friends, but I could not go out, nothing. I was just finding a medium to vent and rant about my motherhood, my motherhood, pregnancy, and all of that. There's no one to talk to, my husband used to just go to hospital, and then I found this way out. I just created it just for fun, just to put my points across and, just to make friends and just chill. And then slowly, I realized that, my medical blogs that I used to put is getting appreciated. It's getting acknowledged, by people, and people are interacting with me. They're kind of liking my vlogs or, the thing that I put out. And then slowly I started getting work. I started working with brands. And later I realized कि मुझे अभी थोड़ा सा niche create करना है. पहले तो my niche was all over the place. I used to just talk and rant about everything. But now I created a niche about only medical awareness surrounding women's reproductive health. So I'm working with brands only that is, that's aligning with my niche. So I'm not doing anything else apart from that. And plus, newly I've introduced this DHA content because I have seen if I talk about it, it's benefiting a lot of doctors. You know, that way मैंने सोचा आप DHA को भी introduce करा लेते हैं. That's how it just began. And Alhamdulillah, I'm getting a lot of work with brands, and it's like, a part-time blogging, part-time career हो गया है अभी. And yeah, Alhamdulillah. Thank you for acknowledging and appreciating. Yeah.
Okay, sure. So, Dr. Afreen, you have recently started a modest clothing brand as well. So, I would like to know how has that journey been like for you, and what's the story behind it?
Story is, see, venturing and trying my hand at designing and something in fashion has been on my mind for the longest time. This, if I had not been a doctor, I would have probably been a fashion designer because that's how much I love fashion and, just dressing up or designing and all of that. But I never had a time actually. I never found the right time to launch it or do something in it because I was always occupied with my work and personal commitments and all of that. But it had to start someday, right? And that's why I made this. This someday happened long ago actually, but it's just the process that took this long. It's just the process that took this long to materialize and bring it to life. So Alhamdulillah, I think. But at this point in life, at this point in my life, I think I don't know if it's a wise decision to launch a brand because I'm really full. My hands are full with other work, but I'm managing somehow, and it's like my baby. I would say this brand is like my baby, which needs my complete attention and time, which I'm not able to give as much. So, inshallah, let me see what I can do about it. I want people to just appreciate my creativity and acknowledge and love and show support to my brand as well as they have shown to my other ventures. Inshallah, that's all. Just need
Okay,
blessings.
best wishes for you. And now I would like to conclude the discussion with the one last question. What would be your advice for all the medical graduates who are wanting to pursue a career in medicine, particularly in UAE?
See, UAE may again, I think I forgot to mention that there's a lot of confusion about one thing. They think DHA is the only exam for the entire UAE, which is wrong. DHA is the exam only for Dubai, only for the Dubai Emirate. There are 7 Emirates in UAE. Dubai, everybody wants to come to Dubai, but you need to know one thing that Dubai is not the entire UAE. You have other Emirates as well, like Abu Dhabi, Sharjah, Ras Al Khaimah, and many other 7. There are a total of 7. DHA is only for Dubai. Had or DOH is for Abu Dhabi.
Mm-hmm.
Okay, and MOH is another exam wherein the other rest of the Emirates fall under. So you need to understand that DH is only for Dubai. And my advice would be, Habibi, come to Dubai because this is the best place you can come and work in terms of the quality of life and the salary that you get because it's really, really amazing place also. Entertainment and everything. So just work hard, read well, and if you need any help in terms of training, I'm always here. So you can take my help if you need any training or any guidance for that matter.
Okay. Thank you so much, Dr. Afreen, for sharing your valuable insights with us. It was an amazing session, and I got to learn a lot from you today. But I'm pretty sure that people will get some real value out of it.
Yeah, inshallah. It was my pleasure. Thank you.
Okay, so
Thank you for
यहाँ पे अपनी डिटेल्स वगैरह भी अगर आप शेयर करना चाहें तो कर सकती हैं आपका क्या प्लेटफॉर्म है एंड अगर आप कोई कांटेक्ट करना चाहें तो उसका क्या प्रोसीजर है.
Yeah, so basically, I am a mentor and instructor in medical MCV for all. That is, and it is a training academy which is online as well as physical offline. I'm managing the offline part in Dubai, We have this office and classrooms and everything, and we have students coming from all over the world. Global. Alhamdulillah, it's been going on for 10 years now. But I recently joined the team, and yeah, if you join this, I would say, if you really, really want to pass and if you want to come and work here in Dubai, I think getting a training and a right direction. Because if you start, you don't know how to start. If you take guidance, if you want to, if you need help from someone, I think training is the best thing to do. Get trained and leave all the admin part, because you only need to focus on the studying part. Admin part, as the registration, data flow, leave it to the people who are really experts in doing that. And
Yeah.
all you need to do is just focus on studying. At least keep 2 or 3 months, a good 2 or 3 months to study, and then give your exam. Don't be in a hurry. Just ये सोच लिया कि okay, I know थोड़ा बहुत पता है मुझे, and I'll just go. You will never be able to clear it. Take it from me. You will have to be really, really good at your subject, and only then give the exam. And yeah,
Okay, thank you so much.
if there's any other help needed, it's the website. I will tell you, it's Medical MCQ for all. You can contact us anytime.
Okay, I will pin the details in the description box and people can contact you if they want.
Yeah. Thank you.
Okay.
Thank you.
Thank you so much, Dr. Afreen.